we have a symptom, or is it more, should we be thought of more as a preventative measure?
It's a great question. You know, the true core of what we preach and what we do is more preventive, you know, medicine. We down the road, despite what's going on with people, at some point we usually start dabbling a little bit into their lifestyle, nutritional stuff, you know, activities. And, you know, because a lot of that builds up into dysfunction. And so when we can kind of restore that, get a lot of that stuff out of the way, what really kind of preaches, all right, we got you there, now let's keep you there. The best patient, you know, are those people, especially, you know, early on in life, if you can just come in asymptomatic. We're not having to palpate through a lot of pain. We can find things a lot easier and correct them a lot easier and get it to stick with your body because, again, you haven't dealt with it for the last year or 2 years or whatever happens to be. So, you know, like I said, you know, at the base of everything, we really, you know, kind of preach preventive medicine. So, you know, coming in, you know, at the first sign of things, certainly, especially with acute care, you know, I just bent over and picked something up and my back went out. Well, instead of waiting, you know, for you know, that to kind of heal up itself, a good thing to do is once it's calmed down a little bit, I'm talking about maybe within, you know, the first couple of days, get right into our office because you respond a heck of a lot better if we can tackle up those things right away. Then, like I said, if they kind of carry with you and are there a little more chronically when your body's kind of set into that, to dealing with that stuff.
And I think our profession hasn't done a good job of the whole kind of like dentistry, get your teeth cleaned every 6 months. I think a lot of that is unfortunately controlled by insurance. Insurance pays for acute pain. They don't pay for you to stay healthy. Now things are changing. They're trying to get you to go work out, and so maybe that'll change. But in our industry, yeah, that would be it. I mean, as you know, the nervous system controls everything in the body. So if you're out of pain and your immune system's functioning better and digestion and everything else, you're just a healthier person. So yeah, that would be, if we got to a point where everybody just came in to maintain health, that's kind of where I think healthcare is going because it's going to bring costs down. But a lot of that, unfortunately, now is kind of dictated by insurance and acute care. Let's go back.
How do you feel about inversion tables?
Inversion tables for the right person is fine. Inversion tables, if you're not familiar, you know, you have the tables that you can hang upside down like a bat. Now, I don't tell people to do that. That is bad, especially if you have an elderly person with like congestive heart failure to tip upside down and have your blood pump the opposite way. Bad idea. Most of them kind of tip at an angle so that your head's below your feet and you get a light distraction on your lower back. It's a little non-specific, so if you have arthritis, degenerative discs at multi-levels, problems in your lower back, a light distraction on lower back on a daily basis can help. The problem with the tables is it's a little non-specific. So you're distracting lower back, you're distracting mid-back, you're distracting neck, you're distracting muscles. So you could aggravate. So a lot of the times I say, you know, you could try it, but if it doesn't seem like it's helping, don't do it. And that's kind of like the table we have. It's a little more specific where I can just distract your lower back if that's what you're going for.
Isn't that good though if you're always standing on your feet? If you hang on your back, you kind of, you know,
Even if you're healthy, your cardiovascular system's not, in my opinion, is not meant to pump backwards. So if you're doing it, I wouldn't do it for 15, 20 minutes. Because you literally can, and I'm guessing you do, you lock your feet in and you are, you know, flying around. So I would prefer that you just kind of keep it a little more where your head's lower than feet. But when I was in chiropractic school, I worked at a Relax the Back. So we sold those, and you know, I was a perfect candidate because I was in chiropractic school. And there would be these old guys coming in wanting to hang upside down, and I'm like, not on my watch. No way. So
That's something that case by case basis. You know, I've got one in my office that I'll let people try out if it's something that I think would benefit them, just to make sure I'm around. And yeah, you don't want to keep them on there for 15, 20 minutes, but those patients that may be contractors, roofers, have, you know, repetitive flexion jobs, or just haven't been trained how to properly squat, and have worn those discs out, you know, or have a onset of an acute disc, and you know, once it's kind of calmed down, again, you know, I'll take them and just tilt them back. I usually don't go any further past about 45 degrees decline with them, but they usually do pretty well, especially if you can recommend that to them. You haven't tried it out and they've got an inflamed disc. And you say, hey, every day when you get home, spend 5-10 minutes on it. Just let those effects of gravity kind of get reversed for a little bit and pull some fluid back into that disc. They usually respond pretty well. But again, it's a case by case basis. You want to make sure that they don't have any contraindications first to being on it. But in my experience so far, I've seen a lot of people benefit from having those if they've got disc issues that on a chronic basis. So.
We have a question from Wapan. They are wondering, is cracking your knuckles bad?
You want this one?
Sure. Well, when I was going through school, the research that they had put in front of us is it doesn't negate or support a detrimental effect. Now, if you think about how people in their hands develop arthritis, what does it usually look like? Flexed, fingers start deviating to the side. And how do people normally crack their hands? Into flexion. Again, that's a repetitive motion event, and when you're always doing that, especially the nature of when people do it, it's somewhat of a daily thing that they do. They do it, if they're nervous, things like that. And that doing that over time, again, it's just going to take what we already do too much of, and that's have our body into flexion, writing, doing typing, and pushing it into that motion. If anything, it should be stretching the fingers backwards, and reversing those effects of arthritis wanting to take everything into flexion. So, personally for me, I'd say that if it's a repetitive thing that you do, if you're stressed or anxious or you just do it all the time, definitely bad for you. If you feel like, you've been working all the time, on a keyboard or writing and your hands are sore, stretching backwards is totally appropriate. It takes your body into the exact opposite motion of where you're going. Now, if you're having, wrist issues and chronic hand problems, we're really the best ones to be manipulating that. But again, what we've been exposed to is that the research doesn't negate or support it. If you're doing it, on a consistent basis, indeflection is probably not good for you. Question?
In schooling?
Yeah,
A ton.
And then another topic or another question. Do you ever or would you ever refer to a registered dietitian?
I was actually looking into I know we have dietitians here and how, okay. Perfect. Because, as far as our schooling, we get some pharmaceuticals, but we don't prescribe medicine. By law, we can't. So we get some pharmacology, but not a lot of it. All that's made up by nutrition. And a lot of chiropractors get after nutraceuticals, things you can take nutritionally that have kind of a drug-like effect. But that's a whole nother thing. But as far as nutrition, we're into that. That's why we're getting it into the Agnesian Health Shop. But a lot of times we get into a disc patient and you find out that they're pre-metabolic and they're on borderline diabetes, and I don't want to sit down and talk to them of, okay, you got to get on top of this, because if this gets into full-blown diabetes, now that's a gateway disease. And if they could sit down with a dietitian and talk, I'd be all for that. So, are you a dietitian?
I am.
Perfect.
But what I've kind of found, and it's finding good dietitians that we can refer to that isn't just specifically for diabetes. That's what I've been exposed to first and foremost. Hey, I got a patient that I want to refer, but they can only take diabetic patients, and maybe if they're borderline, they haven't been diagnosed yet, they're insulin resistant, metabolic syndrome, they're a perfect candidate, so if you deal with those patients, get us your information. Okay.
General population. But then-
Wahoo. Perfect.
And that's a lot of our practice is supporting the body biochemically. So going through some of those nutritional patterns and finding out if there's certain things that can deplete the body biochemically of certain things, not only addressing their nutritional trends, but also figuring out how we can correct some of the systemic dysfunction by supporting their biochemistry. It really gets us better results.
I think we need to wrap it up here, but maybe the doctors will stay if you have a follow-up question. Thanks for a great presentation today.
Okay.
I need
Drawing
you to
for our
pick 3 winners.
veggie
I'm gonna
bucks.
go way to the bottom.
Okay,
3 winners?
3
You
winners.
want me to?
Sure.
Dan Lang. Baha.
Right here.
What did you say? You probably know better than me.
Okay. Barb Harmson in Waupun.
And we'll dig a little deeper.
And also Karen Gross in Waupun.
Excellent. Just a reminder, the doctors will be here again at noon, so if you enjoyed the presentation, please tell your peers, your associates, your friends, and have them show up at noon. Thanks again.